Hi, my name is Anwita Mittal, and I'm a rising senior from Northern Virginia. I'm interested in pursuing a career in the medical field, potentially majoring in biochemistry. In school, I'm an officer for various service based clubs, such as the Helping Hands Club and my school's chapter of the nonprofit Service Beyond Borders. Additionally, I'm a strong standing member of my school's Science Olympiad team and Science Honor Society. In addition to debate, I'm my school's FBLA Middle School Outreach Director and will be the FBLA Vice President this following school year. Lastly, I'm actively doing research about CAR T cell therapy, and I will discuss my findings in this presentation. Acute lymphoblastic leukemia, also known as ALL, is a type of cancer that occurs when the bone marrow makes an excessive amount of lymphocytes, which are a type of white blood cell, and this results in a shortage of regular blood cells. Acute lymphoblastic leukemia is the most common type of cancer in children, and although it is most common in children, it has a survival rate of only 30 to 40% for adults. This year in the US alone, there have been about 6,100 new cases of ALL, about 3,450 in males, and 2,650 in females, and about 1,400 deaths from ALL. This doesn't even include cases that were diagnosed in previous years, thus making this diagnosis a prominent issue. And in 2021, there were nearly 167,000 cases of ALL in children globally. Symptoms can include shortness of breath due to having an enlarged thymus, having pale skin, weakened immunity, bruises, and also increased bleeding during times such as during nosebleeds and menstrual bleeding. Additionally, weight loss, fever, and swelling in the abdomen can occur, and these symptoms can spread to other organs as well. Potential methods of treatment include chemotherapy, both intrathecal and systematic, radiation therapy, chemotherapy with stem cell transplants, target therapy, and immunotherapy. Chemotherapy tends to result in painful side effects such as tiredness, feeling sick, nausea, vomiting, having a sore mouth and throat, a weakened immune system, which can mean one is more likely to get infections, a lack of energy, shortness of breath, and noticeable heartbeats. Although it tends to have a higher cure rate for pediatric patients, the cure rate for adult patients remains very much suboptimal. Radiation therapy can help reduce an excessive amount of lymphocytes, but it can also end up lowering the overall cell count, and this can result in fatigue and shortness of breath due to a low red blood cell count, bleeding or bruising due to a low platelet count, and an increased risk of infection due to a low white blood cell count. So, what exactly is CAR T cell therapy? CAR T cell therapy is a treatment that can eradicate advanced cancer completely for long periods of time. A patient's own natural T cells, which are part of the immune system, are used to perform this type of therapy. T cells, which are known as T lymphocytes or thymocytes, develop from stem cells in the bone marrow and usually protect the body from infections. In order to make these treatments, blood is collected from the patient and then T cells are separated. These cells are then genetically engineered to produce a specific type of protein on their surface, which are known as chimeric antigen receptors, or CARs. The CD22 receptor is a protein receptor which is overexpressed on ALL cells. The protein is partially attached to the inside of cells, runs through the plasma membrane, and then a greater portion is present external to the cell. The region near the end of its amino acid sequence is particularly more susceptible to having various sorts of interactions with other cells. This section of the receptor is able to interact with the chimeric antigen receptor on T cells, which can have various types of nanobodies attached to it. Once such interactions occur, perforins are released, making holes in the cancerous cell, allowing for apoptosis to occur. In my research, I used molecular docking, which is a computer-based method to determine the most effective binding mode of a ligand with the three-dimensional structure of a protein. So I used three different forms of databases. First, I used UnitProt, and I got my CD22 protein amino acid sequence from here. Then this was inputted into the AlphaFold 3, and then it modeled the structure of the CD22 protein, followed by the use of Protter, which provided illustrations of how the CD22 fits within a cell. Next, I used PrankWeb, which was a machine learning-based method, which was able to predict where the binding site would be for each of the nanobodies with the CD22 receptor protein. Additionally, H-stock was used in order to provide a visual representation of this bond between the nanobodies and the CD22 protein. Lastly, a protein ligand interaction profiler, or known as PLIP, was used to enumerate the specific chemical interactions that would occur between the nanobodies and the receptor. The image here depicts various CD22 nanobody interactions which were derived using molecular docking simulations on the H-stock software. There are 9 types of nanobodies which were compared above in terms of their physical fit with the CD22 receptor. The structure shown in purple represents the CD22 receptor, which is attached inside the cell membrane, partially located in the extracellular space of the membrane. Each of the nanobodies, which are shown by the pink molecules, bind to their respective binding locations. The protein structure of the CD22 receptor is a polypeptide chain, thus it is composed of many amino acids joined together. Additionally, each amino acid has a unique chemical structure attached to it, which is named an R group. These chemical structures are composed of many different elements and those combinations of those elements. Therefore, each structure has properties that affect how that section of the 3D structure of the amino acid chain would be shaped. There are unique properties of various sections of the protein, which allow it to interact with sections of other proteins in specific ways. Some interactions, such as chemical bonds, are stronger than others. The chart above describes the interactions between the CD22 receptor protein and various nanobodies. Through the use of a protein ligand interaction profiler PLIP, the above chart is able to successfully enumerate types of chemical interactions. Out of the listed interactions, hydrogen bonds and salt bridges create stronger bonds between two molecules. So, the 5-DAO nanobody has the greatest amount of hydrogen bonds and salt bridges combined. Therefore, when it bonds more strongly with the CD22 receptor. This image shows a three-dimensional representation of the interactions that occur between the CD22 protein receptor and the nanobodies. Through molecular docking and computational simulations, it can be concluded that the 5DA0 nanobody most effectively pairs with the CD22 amino acid sequence. Thus, the nanobody 5DA0 was selected as an appropriate candidate. Researchers are now able to use computer-based tools and simulations to help identify potential biomarkers that indicate disease in the earlier stages of research. This allows them to narrow down the most promising targets using data and models and accurately cure aggressive and difficult cancers. I would like to thank Dr. Sharma from Egan Sciences for his mentorship and guidance through this research. These are my references. Thank you so much for listening.